All right, about 39 minutes to the closing bell, and so long, mask, hello, fresh air. If you're vaccinated, Anjalee Khemlani joins us with the latest from the CDC, COVID-19, and whether you have to wear a mask or not. Anjalee?
That's right, Adam. We got the final details today from the CDC, and it basically all stays the same with the exception of when you're outdoors and you are fully vaccinated, you are safe to move about in most situations, except for when there are crowds nearby. We still run the risk of not knowing who is or is not vaccinated and the transmission from there. Unvaccinated individuals, however, still have a lot more precautions to take. But as it stands right now, being outdoors by yourself, running, biking, whatever, you can take off your mask. And if you're in a small group, you can also take your mask off, especially if you're fully vaccinated. Unvaccinated individuals still recommended that they wear a mask. So a little bit of good news, as the CDC director said today during the briefing, that for the past year, we've been telling Americans what not to do, and now we're telling them what they can do. So something that a lot of experts have been looking forward to. Meanwhile, concerns about what the rest of the year is going to look like. While some experts do say that it's likely that the U.S. is going to get out of, really the full force of the pandemic by summer, it is possible that we still see the need throughout the year to continue maintaining distance, masks. And then the question of boosters comes up. That's something that Dr. Ashish Jha, the dean of the Brown University School of Public Health, addressed today. Listen to what he had to say.
We're going to obviously be tracking breakthrough infections, waning immunity. We're going to have to look for correlates of immunity. There's a lot of science that needs to go into figuring out when will people need boosters. I don't think anybody's getting a booster in 2021.
So that's something that's interesting. We've heard the vaccine CEOs of both Pfizer and Moderna say that between 6 and 12 months, it's possible we'll need a booster. We've gotten to the 6-month mark, and the efficacy of the vaccines is in place. So we know it's durable for that time, but the 12-month mark is what we'll have to wait for fall to find out. And that's something Dr. Anthony Fauci has said. Meanwhile, we do know that in India, of course, the concern there, and that is something that the U.S. officials have continued discussing and looking at. Aid is being sent, and the timeline of that remains unclear. We do know that a mix of ventilators, oxygen tanks, and supplies, as well as protective gear, along with those vaccine doses that need to wait for quality checks from the FDA before being sent out, are all underway. Dr. Jha did also address that, saying that it's possible within the next few weeks. So a lot of concern there, as we know that the more cases India ends up having, the more we see potential for variants. So that is where that concern comes from. Back to you guys.